Welcome. In this session, we are going to look at the gluteal region. We'll be focusing on the osteology of the gluteal region. Those are the bones, namely the hip bone and the proximal femur. We'll be also looking at the cutaneous innervation of the gluteal region. So welcome all. My name is Wallace Munyere and I'm the Yule Daktari. So thank you. So gluteal region, let's discuss its boundaries. Its superior boundary, let me use a cursor here. Its superior boundary are the iliac crests. That's the superior boundary of the gluteal region. You can palpate this on yourself. The inferior boundary is the gluteal fold, this. And note, these gluteal folds, this is not the lower boundary of the gluteus maximus muscle, as most people think. No, that is just a transverse skin crease. It's just like a skin crease. It is the transverse skin crease of the hip joint. That is simply what the gluteal fold is, the inferior boundary. Then, a lateral boundary is an imaginary line which usually connect the anterior superior iliac spine, which I've abbreviated here as ACEs, to the greater trochanter. This is the greater trochanter anteriorly, so a transverse line which will be running from somewhere there up to there. This is an imaginary line. That is the lateral boundary. Then the medial boundary is this, the cleft between the two gluteus, the intergluteal cleft or the natal cleft. That is the medial boundary. So know those boundaries: superiorly, iliac crest; inferiorly, gluteal fold; medially, natal or the intergluteal cleft. Laterally is an imaginary line connecting the anterior superior iliac spine to the greater trochanter. Those are the boundaries. Now let's look at the pelvic bone. The pelvic bone is formed by fusion of three bones: ilium here, ischium here, and pubis here. Okay, so you can be asked to side the hip bone or the pelvic bone. How will you do it? The acetabulum should be directed laterally. Okay, this acetabulum should be directed laterally. This obturator foramen, as you can see, it should lie below the acetabulum. This is the ilium. The flat expanded ilium is directed, this is the ischium. This is the ilium. Sorry for that. The ilium should be directed upward. This is the pubis, and it is then, you can see it is directed anteriorly and medially. The thick ischium here should be directed posterior-inferiorly. So the ilium here should be directed upwards. Pubis should be directed anteriorly and medially, anteromedially. The ischium here should be directed posteriorly and inferiorly, posterior-inferiorly. Okay. So I've said the pelvic bone is composed of by fusion of three bones: ilium, ischium, and pubis. I will show you a good diagram where I have colored them differently. So this is here we have the pubic tubercle. The pubic tubercle and the anterior superior iliac spine should lie in the same coronal plane. And the istiotuberosity, is the part which you sit on, should occupy the lowest position. So by using those procedures, you can be able to side like this. If you are given of this side, this is which side? Yes, this is the right, this is the left. Yeah, so this is the right side, this is the left side. So you should use these procedures to know which side it is. So by doing that, you will be able to side. Siding means from, is it left-sided or right-sided? Now, as yes, here I have colored them out. In this color, this is the ilium, this is the ischium, and this is the pubis. You can see it has several parts. This is a lateral view as you can see here. Now this ilium, this surface is known as the gluteal surface. The gluteal surface or the wing stroke ala of ilium. On this gluteal surface, we have three important lines. The gluteal lines, we have a posterior gluteal line, an anterior gluteal line there, and the inferior gluteal line there. Okay, you'll find some text which usually call the anterior gluteal line as the middle gluteal line. Okay, depends on which author you are using. So you should know these lines. They are very important, especially when it comes to the origin of the three gluteal muscles. We will look at that. So you can see this is the anterior superior iliac spine there. This is the anterior inferior iliac spine. We have muscles and ligaments which originate from these two. We will look at them. Then this is the acetabulum. This where the head of femur usually insert to form the ball and socket joint of the hip joint. And you can see the acetabulum has parts. This part here is, I'm trying to, that is the lunate surface. Okay, that is the lunate surface. Then you can see this is the margin or the limbus of acetabulum. Then you can see this margin is not complete. It leaves a gap here inferiorly. That is known as the acetabular notch. Then you can see this part here, the deepest one, that is the acetabular fossa. Okay, that is the acetabular fossa. Here is the obturator crest. Then this in red is the pubic bone. You can see it has a superior and an inferior rami. This is the superior pubic ramus, inferior pubic ramus, where they meet at the pubic tubercle there. Then this is the istiotuberosity. You can see it has this part here is quadrangular. It has a quadrangular part and a triangular part. You will see that there are some muscles which originate from this quadrangular part, which is also divided into two, and this the triangular part of the istiotuberosity. It also has a ramus. This is the ramus of istium. This part you'll find some text which usually refer to this part where the pubic bone and the istium meet as the istiopubic ramus. Istiopubic ramus. Then this is the ramus. Then it has a body here. Then it has a very important thing here, a landmark, the istiospine. This is a very important landmark in that the istiospine is where when you want to carry out a pudendal nerve block, you identify the istiospine. That is where you do the injection of the anesthesia. So istiospine is the site of pudendal nerve block. Then you can see here is the body of ilium below the inferior gluteal line. That is where the body of ilium is. Then you can see here another very important. There is a notch here. That notch and also this one. You can see there are two. This, which is below the istiospine, is known as the lesser sciatic notch. Then this which is above is known as the greater sciatic notch. Then above the greater sciatic notch, we have this, the posterior, inferior iliac spine. Then superior to the posterior inferior, superior to the posterior inferior iliac spine is the posterior superior iliac spine. Okay. Then we have an iliac crest here. The iliac crest, the superior boundary of the gluteal region, which has an outer rib, an intermediate zone, and an inner rib. Those ribs are very important, especially when we will be looking at the origin and insertions of muscles of the anterior abdominal wall. Some muscles like the external abdominal oblique will originate from the outer rib. So that is just an example. So, but I want you to understand all these parts. Okay. So that was the lateral view. Now let's look at the medial view. This is a medial view of the hip bone. Now, you can see this is the iliac fossa. This is still the anterior superior iliac spine, anterior inferior iliac spine. Then we have this, the iliac tuberosity and the auricular surface. This is where it articulates the sacrum to form the sacroiliac joint. You can see where the posterior inferior iliac spine is and the posterior superior iliac spine is there. This is the greater sciatic notch there. Lesser sciatic notch. Between the two is the ischial spine. Then here we have the ischial tuberosity. Okay, this was the body. This was the ramus. This was the ramus. Then I told you where these two conjoin is known as the istiopubic ramus. Then this is the inferior pubic ramus, superior pubic ramus. This is the obturator foramen, which in life it is covered by a membrane, the obturator membrane, and leaves a small gap, the obturator canal. So then this is the symphysial surface, where it articulates with where the pubic bone of one side articulates the pubic bone of the other side at the pubic symphysis. Then we have the pubic tubercle there. Then we have this very important line. This very important line here, the pectineal line or the pecten pubis. That is a very important line because a muscle, a key muscle known as pectineus, usually originate from there. Then where this the superior pubic ramus meets the ilium, we have an eminence, the iliopubic eminence there. Then we have a line which usually run from the auricular surface towards the iliopubic eminence known as the arcuate line. Okay, this is the medial surface of the pelvic bone. Okay, so I want you to identify all these parts. This is a diagram. This is a diagrammatic representation, but mostly in exams, especially in sports exams, which you'll be doing, that is if you are doing medicine and surgery, they like using cadaveric images. I have them. So let's look at a cadaveric image of the same. Now here we are. This is the lateral view. This is the medial view. Now, if we try to side, can you try to side this? From which side will it be from? Is it left-sided or right-sided? So, as you can see here, the acetabulum is already facing laterally. The obturator foramen is inferior to the acetabulum. The pubis should be anterior and facing medially. The ischium here should be posteriorly inferiorly as it has been placed. The ilium should be superior. So if I do like that, you will see that this is the right pelvic bone. This is the right. Yeah, this is the right. This is a right-sided one. Yes. So you can see it has some parts. A is the ilium. B this part. This is the ischium. This is the pubis. Now, one here is the posterior superior iliac spine. Then this is the posterior gluteal line, though it is usually fade. Then this is the posterior inferior. This is the superior, the greater sciatic notch. This is the lesser sciatic notch. This is the ischial spine, the site for pudendal nerve block. Then here is the body of ischium. Here is the ischial tuberosity. This is the obturator, foramen. This is the acetabular notch, 19. Then acetabular fossa, the deepest part. Then this is the lunate surface. Then I told you the margin is known as the limbus of acetabulum. This is the posterior superior, no, not the posterior, come on. This is the anterior superior iliac spine, anterior inferior iliac spine. This is the pubic tubercle. This is the body of pubis. Now this part here is the inferior pubic ramus. Then we have a superior pubic ramus. Yeah, now this line 20 is the pecten pubis or the pectineal line. Then this is the medial view of the same. This is the auricular surface. Arcuate line over here, 24. This is the where the superior pubic ramus was meeting the ilium, is the iliopubic eminence. Then this is the obturator. This is the obturator groove. You can see it is a groove. We had named that. This is the, as you know, the pubis. This is the ilium. This is the ischio spine. Most parts you have named them. Yeah. Then obviously this is your, what is that? Your iliac crest. And this is the inner lip or the internal lip. And this is the iliac fossa, where we have a muscle known as iliacus, usually originate from there. Now, let's move on. That is the sacrum. You can look at that. You can pause the video and look at parts of the sacrum. Then, now this is two of them. This is your left and your right. Yeah, now this is the pubis symphysis. You can see posteriorly they fuse with the sacrum at the sacroiliac joint here. Obviously, this is your obturator foramen, acetabulum here. This is your coccyx. Now, there is this angle here, the pubic arch. This, the pubic arch. Pubic arch. Okay, that is the pubic arch. Now, you can pause the video if you want to see those parts clearly. And let's continue. Now, this is the superior, not the superior, the greater sciatic notch and the lesser sciatic notch. Then they are usually converted into foramina by ligaments. This is the sacrum here, as you can see, and this is the ischial tuberosity. So we have this ligament here, which is running from the sacrum to the ischial tuberosity, the sacrotuberous ligament. Then we have this ligament here from, this is the ischial spine here, to the sacrum. So sacrospinous ligament. So these two ligaments convert the greater sciatic notch and the lesser sciatic notch into the greater sciatic foramen and the lesser sciatic foramen respectively. So those foramen are very important. Okay. So We will be looking at the contents which pass through them in another video. So this is now is an anterior view of the same the sacroiliac joint. This is your sacrum here. This is your iliac crest. This is the anterior superior iliac spine. Now maybe focus now on this proximal part of femur here. Now this is the head of femur. This is the neck. Then this part here is the greater trochanter. Then this part here is the lesser trochanter. Now this is the anterior surface. Anteriorly, we have a line which usually runs from the greater trochanter to the lesser trochanter. This line marked 11. It is known as the intertrochanteric line. Okay. Then we have a shaft of the femur. Then you can see some foramina here, some holes. Those are the foramina on the neck of femur. Those are known as the retinacular foramina. Retinacular foramina. I will show you shortly. Obviously, this is the obturator foramen. Remember, always remember that this is the ramus of ischium. Okay. Let's continue. So this is the femur now. This is the anterior view, medial view, and this is a posterior view. Now, one here, as you can see, is the greater trochanter. Since it is anterior, this is the intertrochanteric line from the greater trochanter. Now this is the lesser trochanter. 9 here is your neck. Now 7 here is your head. Then we have we usually have when you go to the labs, if you take a femur, you will see at the tip of the head we have like a hole. That is where there is a ligament known as ligamentum teres femoris, which usually insert there. So that hole is known as the fovea of the head of femur. Fovea of the head of femur. So that is that. This is your lesser trochanter. Obviously, this is your shaft. Okay. Then maybe now we look at a posterior view. This is your head, neck, greater trochanter, lesser trochanter here. Then posteriorly, this is a crest, the intertrochanteric crest. This is a posterior view. How will you know it is a posterior? You will see this line. This line is known as the linea aspera. Okay, this is your linea aspera. Then we have a pectineal line here. Okay, and these are very important. Gluteal tuberosity. This, the gluteal tuberosity. This is the gluteal tuberosity. Then this linea aspera has 2 ribs, a medial rib 19, a lateral rib 20. It has 2 ribs. How will you know this is the medial side? You look at the head. The head of femur will always point medially. Okay, the head of femur points medially. So this is the medial side. So greater trochanter is lateral, and the greater trochanter is the one which is responsible for the hips. So hips are due to the greater trochanter. Okay, so those are the parts of the femur. I hope you have understood them. We will look at these other parts of the distal femur when we'll be looking at in another session. So this is now a diagrammatic representation. Head, fovea for the ligament of head, retinacular foramina. This is your neck. Then you have this line connecting greater trochanter and lesser trochanter, the intertrochanteric line. This is anterior view. Anterior view. Now posterior view, the greater trochanter and the lesser trochanter, they are connected by the intertrochanteric crest. This is the neck. The gluteal tuberosity here. Then we have the linea aspera. You can see it has a lateral rib and a medial rib. Then we have here a quadrate tubercle. This quadrate tubercle is important because a muscle usually inserted there. Then those are the parts of the proximal femur. So now let's look at the cutaneous innervation of the gluteal region as the last thing. So cutaneous innervation, this gluteal region is divided into 4 parts: an upper anterior quadrant, or other text will refer it as the upper outer quadrant. It is innervated by the lateral cutaneous branches of subcostal nerve and iliohypogastric nerve. Subcostal nerve, its root value is T12. Iliohypogastric nerve, its root value is L1. So the lateral cutaneous branches of these two nerves innervate this quadrant, the upper anterior quadrant. Then the lower anterior quadrant is innervated by the posterior division of lateral cutaneous nerve of the thigh. Other texts will refer this nerve as the lateral femoral cutaneous. Lateral femoral cutaneous nerve is the same as the lateral cutaneous nerve of the thigh. So its posterior division is responsible for the cutaneous innervation of the lower anterior quadrant. Then the lower posterior quadrant is innervated by the perforating cutaneous nerve. These are its root values, and also by the posterior cutaneous nerve of the thigh. The other name of posterior cutaneous nerve of the thigh is posterior femoral cutaneous nerve. So S1, S2, S3. Then the upper posterior quadrant is innervated by the dorsal rami of L1, L2, L3, S1, S2, S3. Okay. Okay, you have seen that. So this is T12, L1, L2, L3, S2, S3, S1, S2, S3, and these are those as I have said. So you can clearly see that L4 and L5 spinal cord segments are not represented in the gluteal region, and you will see where they are usually represented. So that, please, I urge you, this diagram, please keep it in your mind. This diagram is very important, and you'll find it in your exams. So thank you for your attention, and subscribe for more anatomy and biochemistry content. So we have come to the end. Thank you.